Good morning, welcome back. Good afternoon, welcome back. You're watching the broadcast and thank you so much for staying with us. And we now get into a discussion that surrounds the impact of the pandemic on informal settlements. And with us, a team from the Kibra, Nairobi Sub-County COVID-19 team, 21 non-governmental organizations brought together by that team, one open plan and how they intend to roll out programs for the people of Kibra who have been affected by the pandemic. On my immediate right is Vincent Ayako, the program manager, I Choose Life Africa. Thank you so much for coming.
Thank you very much.
Time's appreciated. Angelina Sikanda at the center is the program development manager at the Center for Awareness Creation. Isaac Gomba is the Sun Program Officer, Shofco, that is Shining of Communities. I appreciate your time for purposes of gender balance. Angelina, I'll come to you first because that has been the debate in the other spheres of governance in the country. How are you planning to address the impact the pandemic has had on the people of Kibra?
Well, as part of the Kibra COVID-19 team, what we've done is that we've brought on board everybody who's working within Kibra so that we can coordinate our activities together as a group. So that whatever efforts, whatever support every institution has, then has impact and reaches out to the most vulnerable of the communities. So we synergize on our efforts, we synergize on our activities, and making sure that nobody's left behind, and that whatever activities we engage, then there is support to those who have been adversely affected within the COVID-19, and especially our women and girls, and especially young people, who are really trying to understand what to do right now, and especially at this point when you're moving into the recovery process.
Okay, we'll come to the aspect about the segmentation of the demography because there are more people who are vulnerable than the other in the society. Isaac, to you, the most important aspect here is the bringing together of more than 20 non-governmental organizations. It means then that this is a prime target for you guys. So what is the modus operandi or the formula that you intend to roll out in targeting the people who are vulnerable within Kibra Sub-County?
So for the past 6 months since the pandemic breakout, it has been like a talking point of organizations coming together like Kibra, so that maybe they have a lot of information from where we are working from and a lot of vulnerable persons where we are working from also. So when we share out, we talk together, we discuss and come up together, we are able now to reach out and also share some of the topics and how we can be able now to help them out. So this is very important, not just for organizations, but also for our beneficiaries, because we are able now to talk and also have a synergy of where we are coming from, and also after post the recovery, what else after now the president is going to open up the economy, what after that? What about the beneficiaries? So that is now the issue that when we are together, we are able now to move to the next level.
Okay, Vincent,
yes.
One key element is very, very significant here, and that is the leveling up of the economy. Therefore, many Kenyans now, besides the government incentives, want hope. Are you offering that hope?
Yes, thank you very much. Just to complement before I answer the question, the Kibra Sub-County COVID-19 response team was to address issues to do with competition. There's a lot of resources that comes in Kibra, and with the resources without proper plan, they say planning without a plan, you plan to fail. Failing to plan is planning to fail. So we formed the one plan, one plan, one budget, one coordination, and one M&D. The president said that the deputy county commissioners within every sub-county should be able to coordinate the COVID-19 interventions. So we agreed as CSOs in Kibra, let's come together to support the government to create a larger impact, because each and every organization, they had a bit of resources to be able to do this. So just to answer your question, there is hope, because at the end of the day, you find the COVID-19 intervention has really affected a number of businesses. And there is now need to recover, to support businesses to be able to come up again. And one of the measures to do that is by reopening the economy, because you find due to the rules that were put in place, a lot of businesses went under, a lot of people were laid off. So when it opened, then that now means that business can gradually come to fruition. And some of the interventions that we have, like I Choose Life Africa, we have the Jinue Business Accelerator Program, where young people or any person who was affected by business can be able to come and get small seed capital to just restart their lives.
Okay.
So we have the Jinue Chap Chap, which we can be able to give them to them, and also the Biashara loans. And we are targeting the marketplaces and also young people who are in business and wants to restart again.
Okay, Jacinta, one of the key aspects about this developing is the government, which is at the epicenter of all this. So what's your point of convergence in aiming for the one goal, that is to help the people come out and limp out of the impact of the pandemic?
For us, the point of divergence with the government is not really divergent per se, but rather what we are doing is complementing. There are certain stimulus that government has offered that are supposed to make businesses possible, that people are now, we have reduced the payee, for example. We have been offered opportunities for those who need to rebuild to be able to access loans. So for someone who is in informal settlement and has no guarantor, had no collateral at the back of their business, what do they offer? And so as CSO, we are coming in to cushion that kind of a platform by saying, rather than you go for a bank loan that will be difficult for you to pay because right now there's no business, why don't we come in and cushion you and give you a grant where even the loan interest, if you are to pay, is even lesser than what government is offering,
Okay.
and therefore enable you to start, and what banks offer or SACCOs, and so that you are able to help them and give them in-kind support, which they are not paying back, that helps them to rebuild and start again to do their businesses.
Okay,
Yeah.
Isaac, on the 4 aspects about your rolling out, and this is the coming together of more than 29 governmental organizations, what do they entail?
So, for example, like Shofco, we had 4 major ones, which one was, we have like hand washing stations across our site, which is the informal settlement that Shofco is working. And then apart from the hand washing station, also there's the part of sensitization on this disease and how we can be able now to prevent it. And then apart from that, we also have the issue of, we've been also distributing food to vulnerable families that were not able now to be able now to cope with life during that hard time. Apart from that, also we've been providing water with water trucks to these residents because a lot of them could not be able, because water was one of the sensible items during this time.
Yes, because of the hand washing.
Yeah. Not just hand washing, because also home. Yes.
It's still a basic necessity.
Sure. So that is part of, like now Shofco, each and every of the organization that here were stepping in with a certain aim to be able now to uplift our community. And where, like you have seen, we are working from urban informal settlements. So through that, we are able now to live the lives a little bit, not like we were able now to have everything, but a little that we could be able now to provide in such, like the 4 that I've said, was able now to live them during that hard time. Yeah.
Okay, and then if I may come to you, do you have the same 4-point agenda plan, or is there a point of convergence in the rolling out of such an agenda?
Thank you very much. The 4-point agenda plan was based on 3 thematic areas. One was on prevention aspect, which was geared towards increasing knowledge and awareness to the people. Initially, when COVID-19 came, you find there was limited knowledge with regards to social distancing and how they can be able to protect themselves. So we focus on prevention aspect, which basically focus on the knowledge aspect. And then we had the second pillar, which was focusing on the curative and treatment. The curative and treatment was focusing on community health volunteers, training on them on COVID-19, and clinical lab technicians and the doctors.
Yes.
So we train them on contact tracing, infection prevention and control, case management, and basically on issues to do with psychosocial support. And then the third pillar was to gear towards addressing issues to do with mitigation, addressing their vulnerability to COVID-19. So among the other partners, they were able to plug in these 3 areas, which the 3 components, the prevention, the curative, and the mitigation, form the one plan agenda. And we had one plan, one budget, one coordination. So crew were very strong on curative,
Okay.
on issues to do with mitigation and cash transfer.
That is in the aftermath of the effects.
In the aftermath of the effect. And also Shofco, they were strong on knowledge issues, hand washing.
Awareness.
ICL was also strong in knowledge transfer and also addressing issues to do with mitigation, food, and also psychosocial support and seed capital for those guys who want to start up their businesses.
Okay, Angelina, now this me to the broader aspect about how do we cope with the COVID-19 challenges. The president yesterday said it's all about individual responsibility, and that has been the key clarion call from leaders across the globe. Angela Merkel in Germany, the UK Prime Minister Boris Johnson, the New Zealand President Jacinta Ardern. Then going forward, even as you roll out these helping programs, how do you also make them understand, make them aware about the new normal that will emerge out of this pandemic?
Well, what we're doing is now encouraging communities to embrace the new normal, not as a temporary measure, but rather as a way of living. That the issue of wearing masks becomes a normal practice, washing our hands every other time becomes a normal practice, maintaining distance, it becomes a practice, and then getting back to our livelihoods. What were you doing before COVID? How do you get back to it? If you're a student, how do you get back to learning? So you've created virtual platforms such that you can start to regain back what we lost within the pandemic. How do you get the young people who are still in college to start engaging back with the institutions to go back to school? How is Mama Mboga going back and making sure that as she does her work, she's able to embrace the new guidelines and still be able to earn a living by selling her wares in the community? How do you make sure that the man who lost his employment is able to rethink and come up with new activities or new economic engagements that can help them earn something and go back and take care of the family while embracing the new setting, such that if we are able to embrace it and make it our new way of living, then it will be easier moving forward, rather than continuing to ask questions, rather than continue to fight government directives and starting to think that COVID is over. No, it's not yet over. It will be over because we have deliberately taken the steps to make sure that we live within the context that helps us to prevent infection and support those who have been affected to be able to recover and go back to reintegrate back in the community.
Okay,
Yes.
Isaac, then what I learned from Angelina's comments, so as Vincent here, is that you are creating a societal mentality that will not only economically help these guys, but also help the government in the fight against the pandemic. So in their minds, how do you create that they are victors in the coming months as we flatten the curve, and that their participation in this is key as we flatten the COVID-19 curve?
Like currently, I think, like they've just said, also the government said we are going to live with it. So we must find out how we are going to have like a way of life on getting out of this. So like wearing of the mask, washing hands. Like now we are going to have like opening of the schools. For example, now like Shofco, we have like our students that were in class 8 and Form 4s. We have started like online classes that I know it'll be able now to explain on what they're doing much better than us. We have been able now to set up a STEM lab whereby our students can be able now to focus and get online classes by enabling like a computer and internet. That is like, it is now going to like a way of, it's going to be like a way of life. For example, our informal schools, do they have such kind of facilities? So that is the point that moving forward as a country, as a community, we should be now focusing on that. Rather than like if you are in suburb, like other suburbs, apart from the informal settlement, it was like life as usual. They had online classes. They were able now
Internet
to get
connectivity.
Yes,
Broadband
as compared to informal settlement, whereby they can't be able now to afford all that. But if you are able now to partner and also have like a strategy on how we can be able now to improve also our schools to get such kind of facilities, is going to help us. But besides that, maybe they are doing it much better. We can be able now to
I'll come to Vincent on that, because let me just couple this with that. And education is very key, especially in the context of Kibra. And when you hear about Olympic Primary, then what comes to mind, and you can vividly recall, that is deeply steered, are the works undertaken by the late Member of Parliament, Ken Okoth. How do we then perhaps see these institutions as places of hope here? Because many have depended on schools, for instance, in an informal settlement like Kibra, to get food, get education, and that was their best environment to be settled in.
Okay. So we say that education is the greatest equalizer in the world. Education is what can make the son of a vegetable vendor becomes an engineer. And education is what can make the daughter of a macabre vendor becomes a pilot. And Nelson Mandela once said that education is the strongest weapon we can use to change the world. So COVID-19 has really changed how things are done. And as I Choose Life Africa, we've been doing STEM online remote learning. We piloted in Kangundo. Currently, we've scaled it up to Kitui and Makueni. And now we've rolled it out to 10 model counties. Okay. So basically, we have a group of 10 teachers who are professional teachers trained, paid by I Choose Life Africa. And they are the one rolling out this program across the board. So learning from Kangundo, Kitui, and Makueni, we realized access to the gadgets, the smartphone was a problem, and also access to bundles was a problem. So in Kibra, the dynamics was different. So we had to think out of the box and see how best can learning continue. So we, through the other partners, we were able to identify remote centers, centers of learning, where we provide bundles and the link. With social distancing, teachers in Kangundo are delivering learning, and learning is continuing. So basically what we can say right now, because the children have been home, and we are saying the children of the rich are accessing education through Zoom. What about the children of the people at the bottom of the pyramid? When the exams come, the exam will not segregate whether you are from a rich person or a poor person. It's providing an opportunity for people to continue with learning by ensuring that we use the spaces available with social distancing, like the churches, the school spaces, and the community centers, providing internet with other partners in Kibra, and our children can be able to continue learning. That phone that mama uses, that is a source of income. She will not be able to give that phone to the kid during the day because that is how he gets the clients on a daily basis. So it's called for thinking and coming up with innovative ways to ensure that learning continues, like what we are doing as I Choose Life.
Okay, now the 4 points agenda as outlined by Isaac, Vincent, and Angelina, all of you, are very much of seeking events that are there and then, meaning immediately. But Angelina, if I may come to you on this, because it's very clear, it's very key and significant. Are you involving the key stakeholders at the community level, the religious leaders who had the places of worship, because we have different dominion, different belonging in terms of our faith, and also the people who know, who understand how the society works, and what's their response in terms of helping you out in terms of rolling out these approaches?
Well, so far we've had very good support from everybody on the ground. As COVID came, nobody knew what to do with it. And therefore, having come together as a unit, then you're able to empower each other and build on the weaknesses of any other group that is struggling to understand, how do I engage? If it's the Muslim faith, how do I make sure that people are able to come in for prayer while respecting government guidelines? Right now, we've increased the numbers to about 200. How do you make sure that even within the slum areas, then the adherence continues on an everyday basis? So it's about engaging, it's about conversations, it's about speaking to each other as brothers and sisters and saying, listen, this is our new normal, embrace it and let's move forward. There are other aspects that have come up. For example, speak about issues of gender-based violence that arose. Our girls were asking, where do we get the pads? The schools are closed, and that's why we were getting pads every day. So we've come in with well wishes and said, let us prioritize such things. So you have, for example, in Kirby, we're going to supply sanitary towels to girls for a year, so that they have access as we wait for guidance on whether or not to reopen schools. Let nobody struggle or suffer in silence. We have brought the groups, the informal groups that have been formed, the chama, chama za wa mama, all those. The youth groups are part of the team. The boda boda riders are part of the team. The nyumba kumis are also part of the team. The security are also part of the team. So that as we work together, then we're able to say, where is the biggest need? Let us uplift those ones. And where people are continuing to struggle, let us also support them and strengthen the little that they're able to do.
Okay.
Yes.
Isaac, then what Angelina has outlined is more or less a community participation and owning the process. And that brings about you belonging to the society and giving your all, whether in terms of advice, in terms of financial support. And in your view, from the ground experience, are people owning up these programs?
Yes. Since the start, I think a lot of people are owning it. For example, since the opening of the churches, a lot of the clergies and the imams are ensuring now, like they have like hand washing stations whereby people are able now to wash their hands. They're reaching out on ensuring that they are able now to do like social distancing. Like currently, Shofco currently, despite just operating the hand washing stations, currently we are trying like distributing like the hand washing stations to people with their own businesses, to institutions like churches, like schools, to be able now to be part of the ownership. They're able now to ensure the guidelines are put in place. They're able now to ensure that to make this, it is part of their responsibility. So that is what kind of like what I'm seeing currently happening on the ground. They have owned it, and they are part of it, that this pandemic, if we don't be in the front line to be able now to tell the people, it is going to overwhelm us.
Okay.
And,
Vincent.
Yes.
Then the common denominator, when you mention informal settlement areas, Kibra, Mathare, Huruma, Kariobangi, are cases of extrajudicial killings by security agencies. And here they are very clear, as Angelina did mention, in terms of bringing them on board, and they are on board. So has the fear between, or the suspicion, or the lack of trust between the people you are targeting and the security who help you here lessened? And how important are you in bridging that gap?
Very good. First of all, allow me to appreciate the support we've been getting from the County Commissioner's, Deputy County Commissioner's Office, Mr. Gideon Ombongi. And through that, we were able to, through our Jongoze project, for instance, we are able to bring the key stakeholders together to ensure that we promote peace, cohesion, and integration in the community. And we are working closely with the Nyumba Kumi initiative.
Okay.
The Nyumba Kumi are very instrumental in bringing peace, and also the various youth groups within the community, and also the security agencies. We've come together in the one plan, one budget, one coordination approach. How that has been able to make it work is we've been able to instill a software in the people of Kibera that they need to embrace the Kenyan dream, that I am the change that I want to see. And when I'm talking about the government, it is I who is the government. We are the people who form the government. So we've been able to ensure that they have a sense of purpose, identity, and inclusion, and they are part and parcel of the solution. We, in Kibera, we stopped pointing fingers. And that's why we said, let's work together. Let's avoid unnecessary competition. It is through reasoning together we can be able to find solution. And the motives of support that we've been able to achieve in Kibra is through local organization, Adopt a Family, Amani Kibera, Center for Transforming Mission, Center for Urban Mission, Little Rock Crew, and all these guys.
Okay.
This time round, I am happy with what the major actors in Kibra have been able to achieve. And they've been able to know that if we point the finger at the government, then we ask the question, who is the government?
Okay, the people.
We are the government. So we know the problem and we have the solution. And with the support of the Deputy County Commissioner, who is very accessible. You can call him anytime, you can anytime. Like for instance, on how to address issues to do with duplication and wastage of resources.
Yes.
We had the Kazi Mtaani, the government is giving funds. We have the Give Direct. We had Crew giving money. So with the support of the Deputy County Commissioner, he opened his office. I said, the government is already giving these guys support. Can we be able to come to my office? We verify this list so that you don't have double people benefiting and others really don't have anything at all. So that one plan has been able to ensure that nobody is left behind by ensuring that we work from a common plan, we vet the list, and ensure that all the needy people within the community are able to get the support.
Okay, Angelina, final round to you and to Isaac. Yes. Then the pandemic has, in more or less many spheres, been the perfect storm to set up things. Yes. Now we are having a discussion at the Minister of Health level on how we can better our facilities, because another pandemic is inevitable. In 1918, we had the Spanish influenza just after the end of the World War I, which ravaged the global economy. Now, how do you maintain such an important contact beyond COVID-19, post-COVID-19, so that the community prospers?
Well, for us, the COVID-19 pandemic has given us an opportunity to reflect and therefore reorganize ourselves in the way that we've been working before. One is embracing technology as a new normal, where it helps you to do things better and be more efficient beyond what you used to do before. Secondly, is being able to work closely with government operations together as a unit, as opposed to what we used to have many years ago, whereby CSOs were seen to be anti-government platforms. But rather, when you're working collaboratively, you are able to achieve more within the little resources that you have. For example, right now, as you asked earlier around the police, we have seen the police come out and give us polycare, and which is something that we are hoping you can be able to work together and roll out in all the counties within the country, and also within the sub-county level. We have seen them giving hotlines whereby you can be able to report such that when you see a police officer, look at them as a service provider to you, look at them as a support network to you, rather than somebody coming in to find out the ills you have done, and therefore that you're going to end up in an acrimonious scenario. So moving forward for us has been that the health department is able to think comprehensively around the issue of health. Yesterday, the government, the president mentioned about establishment of a molecular laboratory in the country that will help us to address some of the diseases that we've been grappling with for years. If we are able to actually implement and hold our leaders to account on those particular plans, then yes, we stand a better chance to be better prepared to address pandemics moving forward. But if we lag behind and go back to the old ways, then we risk losing and not gaining anything as a lesson learned from the pandemic.
Yes, Isaac, final comments to you. How do you keep the community shining on? Because you stand for that, your organization does stand for that.
So I think shining on for communities, we have like giving hope to the most vulnerable and to the urban informal settlements with the goal of turning urban poverty to urban promise. So as SHOFCO, our main focus moving forward is to bring out all the, currently it is on the recovery front. Also we have a SHOFCO circle, which also we are trying to get them back to Mama Mbogas, to get back to business, to revive a lot of business that went down, to be able now to give our beneficiary hope that they can be able now to overcome it and get back to normal life. Also implement on programs on like sustainability and more so to young people, or now they can be able now to get a skill up and get into maybe opportunities and trainings to be able now to earn a living once more.
Okay. Yeah. Thank you so much, Isaac. Your time is appreciated. Alongside Angelina, thank you so much for coming. And to you, Vincent, for the good work you're doing in uplifting the lives of the people in informal settlement. And I'm sure this is will have a rollout effect in terms of targeting the other vulnerable parts of our population in the country. Your time is appreciated. Thank you so much for coming.
Thank you very much.
Thank you to you too. Up next, in about 10 minutes' time, is the 1 p.m. news. We'll see you tomorrow at the same time here for the newspaper analysis and the political developments in the country. Till then, bye-bye.